Dear students, welcome to Bluepen Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
Now, so abdomen, it is a cylindrical chamber. It starts from the inferior border of the thorax to the pelvis, superior margin of the pelvis. So superiorly what will be there? Inferior thoracic aperture. Correct, no? And inferiorly by the pelvic inlet. Correct? And inside this one cavity is this is known as peritoneal cavity. Then, if you are studying the surface anatomy of the abdomen, as you know, this is umbilical region, this is xiphoid process, and this is linea semilunaris, and this is linea alba. Okay, and the fifth here, this anterior superior iliac spine, and the sixth inguinal ligament will come, and the pubic symphysis, where the pubic bones are coming, there is the pubic symphysis. So this is the surface anatomy of the abdomen. Then what is the function of the abdomen? Main function protecting the viscera, second function breathing, and third function changing of your intra-abdominal pressure. Okay, so next we can divide the abdomen into 4 quadrants or 6 quadrants. What are the quadrants? See here. So epigastric region, right hypochondriac, left hypochondriac. So epigastric, right and left hypochondriac. Next is umbilical region, right lumbar, left lumbar. Hypogastric, right inguinal, left inguinal. Clear?
Yes, ma'am.
So these are the different planes which is used to estimate the abdominal structures. Like as you can see in the picture, the one is the midline plane, and 2, this is the transumbilical plane, transverse as well as it is passing through the umbilical region. So this is the transumbilical plane, and 3rd is the costal level, subcostal plane at the costal cartilage of 10th rib and pass through the body of L3 vertebra. Okay, number 4 above level, transpyloric plane between the jugular notch and the pubic symphysis. And 5, this is 5, that is intertubercular plane. So it passes through the tubercles of iliac crest, it passes also through the L4 vertebra. And 6, this is the mid-clavicular plane, it passes through the mid of the clavicle. Did you see the entire clavicle and mid of the clavicle? Yeah. So it passes through the mid-clavicle above, between the midpoint between anterior superior iliac spine and the pubic symphysis. You understood the planes and quadrants?
Yes, ma'am.
Okay. So next about the abdominal wall. Abdominal wall means the skin. See here, skin, superficial fascia, the muscles associated with it. Okay, a muscle associated deep fascia, extra peritoneal fascia, and parietal peritoneum. So these are the abdominal wall. So first we study the superficial fascia. So superficial fascia means what? It's a single layer above your umbilical region, and it become 2 layers below it. So the 2 layers of superficial fascia below the umbilicus are, one is camphorous fascia. Okay. That is superficial and which contain fat, camphorous fascia. And next is Scrapes fascia. That is a deep layer which is membranous but there is no fat. So did you see the camphorous fascia here?
Yes, ma'am.
And here you can see the Scrapes fascia. So these are the 2 fascia. The next about the muscles of the abdominal wall. So one is flat muscle and another one is vertical muscle. Flat muscle we can divide it into 3: external oblique muscle, internal oblique muscle, and transverse abdominis muscle. So there are 3 types of muscle in the flat muscle. Vertical muscle means 2 muscles, rectus abdominis and the pyramidalis muscle. So what are the different muscles of the abdomen?
Flat muscles and vertical muscles, ma'am.
Okay. See the picture. Here you can see the external oblique muscle, internal oblique muscle, and transverse abdominis. So first is the external oblique. Did you see the external oblique on both sides? Okay, so this is the most superficial muscle that is just below your superficial fascia, and here you can see the fibers are coming from anteriorly to anteromedially, from anteriorly medially, and large aponeurotic component which covers the anterior abdominal wall. Then next is the internal oblique. After removing the external oblique, you can see the internal oblique. So here the fibers are supramedial, superior and medial, and the aponeurotic part will be blent with the linea alba. Say central line is the linea alba. So this aponeurotic will be merged with the linea alba as in external oblique. And next here you can see the transverse abdominis. Okay, so the fibers are transversely passing, and this also blend with the aponeurotic portion will be blend with the linea alba. And next is transverse fascia. So this is a deep fascia just below the transverse abdominis muscle. You can see this. Okay, and this has a continuity with other regions fascia like the perineum, diaphragm and all. Next about the, so you learned about the fascias, okay, and the muscles. Then next about the ligaments. What are the ligaments which is associated with the flat muscles of the flat muscles? Now you studied. So what all ligaments are holding these muscles in abdomen in proper way? So first is inguinal ligament. So how the inguinal ligament is formed? You studied external oblique muscle. So the same external oblique muscles in the lower border folded and thickened and forming one ligament, that is the inguinal ligament.